Good evening. This is Mayur from Aster RV Hospital. We are doing a Facebook Live on diabetes. All that you need to know. I have with me Dr. Manjunath Malige, who is the clinical lead consultant for endocrinology and diabetes at our hospital. Over to you, doctor.
Hello, thank you, Mayur. Good afternoon to you all. This is just a small effort to sort of interact with you people, just to give you a basic understanding of what diabetes is all about, which is why we have sort of run the title called Diabetes, All That You Need to Know. There are a few questions that we have received as popular questions from our patient pool, which Mayur is going to sort of collate and ask me, and I'm going to answer these questions one by one. And by all means, if you have any questions that you are actually wanting to ask, please post it online and I should be able to answer it to you. And I hope this session is going to be informative for you. Over to you, Mayur.
Okay, doctor, the first question is it possible to completely reverse diabetes?
Right. As of now, it is not possible to reverse diabetes, but we talk about a different term than reversal called remission, which basically means that one can get the blood sugars under good control even without medications, at least during the initial few years of diagnosis of diabetes, which can be done by good lifestyle modifications, which includes healthy diet and regular exercise. This can bring down the blood sugars to the normal range and literally to the non-diabetic range. But this does not mean that the diabetes has gone away, but this can change in future when you will start needing tablets at some point of time.
Okay, doctor. Thank you for the answer. Another question that our readers have come up with is, why are Indians at particularly high risk of developing diabetes?
Yeah, that's a very good question. Not just Indians, but the South Asians in general. Indians, Pakistanis, Bangladeshis, Sri Lankans, South Asians are at increased risk of developing diabetes about 2 to 6 times compared to the Western population. This is because of our basic ethnicity. By being in this particular ethnic background, that's the South Asian background, that itself puts us at slightly high risk of developing type 2 diabetes. Now, added to this, there also is a large contribution from our lifestyle, which is not always seen as particularly healthy. And there are two aspects of this. One is the diet, and as you all know, our diet is predominantly carbohydrate based. We are predominantly rice eaters. So rice has a lot of sugar in it. Doesn't mean that one doesn't need to eat rice, but we have to cut down the portions. So we are basically rice eaters, and then we hardly exercise in a healthy way. So lack of healthy diet and lack of good exercise with our ethnicity background puts us at higher risk of developing type 2 diabetes.
Thank you, doctor. Doctor, other people also want to know, why is diabetes now seen at a much younger age than previously?
Yes, this is something that we come across every day in the clinic, and this is a pattern that just started showing up, I think about roughly less than a decade ago. A disease that was particularly seen in people who are in their 5th or 6th decade of life is now being predominantly seen in people who are actually younger than 30 years of age. And this is due to two reasons. One is because of the gross change in the lifestyle at that particular age. An age when one is supposed to be physically active and should be eating healthy diet, it's going the other way around. This particularly is seen in those individuals who are doing jobs which are predominantly desk based. They hardly move. There is not much of movement. They are always under pressure, targets to reach, and infrequent meals, untimely food, and most of the times this is junk food. So this unhealthy eating, increased stress levels, and lack of physical exercise at an young age puts them at high risk of developing type 2 diabetes, and this is the main reason why we are seeing younger type 2 diabetic patients in our clinic, and I'm sure this is the pattern all over the Asia.
Thank you, doctor. Doctor, what is insulin pump therapy and who is it for?
Insulin pump therapy is basically treatment of diabetes, wherein insulin pump is basically a small electronic gadget of the size of maybe your mobile phone, which has a slot wherein an insulin filled cartridge can be placed, and it has a software in it which you can program depending upon your insulin requirements as to how many units per hour should be given to the body. So depending upon your levels of blood sugars, we can program the software so that a particular dose of insulin is delivered to your body through a small needle under the skin, and this is called insulin therapy. And this is not for all the diabetic patients. This is particularly for type 1 diabetic patients who do not produce any insulin at all in the body, and sometimes we do use it in type 2 diabetes patients who have significantly complicated diabetes, particularly with fluctuating blood sugar levels and absence of this sort of safety mechanism in the body called as hypoglycemia awareness, which means even if the patient's blood sugars are going low, patient's body would not be in a position to alert the patient that your blood sugars are going low, which can be dangerous. So in these situations, there is a business case to make to start a type 2 diabetic patient on insulin pump treatment. Sometimes we also use this in pregnant diabetic patients to get good blood sugar control.
Thank you, doctor. Doctor, what are the complications of poorly controlled diabetes?
Poorly controlled diabetes has many complications, but the main ones are these. In common man's terms, this increases the risk of heart attack and heart failure, stroke or otherwise called as brain attack, kidney disease and kidney failure. It also interrupts the blood circulations to various organs of the body, particularly the feet, wherein patients can develop what we call as ulcers or wounds on the feet due to lack of sensations or failure of sensations. And this can always lead to further worsening of the blood circulation and can lead to something called as gangrene, wherein a toe or couple of toes or even the foot can die, which we medically call as gangrene. This might end up requiring an amputation, which means that particular part which has died needs to be cut off from the body. So these are the major complications. Apart from that, there is an important complication that can happen in the eye. It's called diabetic retinopathy. Retina is like the software of the eye. So diabetes particularly affects the retina. And when this happens, the patient is at quite a few risks that he could land up in. It can lead to what we call as retinal detachment and sudden loss of vision, and over a period of time they can become blind. In fact, the commonest cause of blindness in the world today is diabetic retinopathy.
Thank you, doctor. Doctor, what are the precautions a patient with diabetes needs to take if planning pregnancy?
Right, this is an important topic. If a patient who has diabetes or who had diabetes in the previous pregnancy, then it's important to consult an endocrinologist to ensure that the blood sugar control is optimal so that a perfect platform is laid before conceiving, because whatever the mother's blood sugars are will be reflected in the baby's blood as well, and it is very important that the mother's blood sugars are well controlled so that the risk of complications to both the baby and the mother can be kept at minimal possible levels.
Thank you, doctor. Doctor, why do some women develop diabetes during pregnancy, and is this permanent?
Yeah, so diabetes during pregnancy, there are two categories here. The first one that we most commonly talk about is called as GDM, or gestational diabetes, or in simple man's terms called as pregnancy diabetes. Now this happens because of the action of the pregnancy hormones on the body. So these pregnancy hormones particularly make the body resistant to the action of insulin that is produced in the body. As you might know, insulin is the natural hormone that is produced in the body, which helps the body use glucose. Glucose is the main energy currency or the fuel of the body. So because of the pregnancy hormones, the body will be unable to use this insulin, and hence the blood sugars go up. That leads to pregnancy diabetes. And this is not permanent. It should go away once the baby is born. So pregnancy diabetes is temporary and it should go away once the baby is born, unless very rarely the pregnancy diabetes can turn into type 2 diabetes, which will only be apparent after the baby is born.
Okay. Doctor, is there a risk of heart attack and stroke in diabetes?
Yes, there is absolutely a risk of heart attack and stroke, as I mentioned to you. There, in fact, are various studies which show that there is anywhere between 35 to 50% risk of either having a heart attack or a stroke, particularly in a person who has poor control of diabetes. Added to this, most of these diabetes patients also have high blood pressure and cholesterol levels, which further increase the risk of heart attack and stroke. So, which is why nowadays we don't talk about just sugar control when we talk about diabetes. It is more of diabetes and heart, diabetes and brain, and diabetes and kidneys.
Thank you, doctor. Doctor, how important is healthy lifestyle in preventing diabetes?
Healthy lifestyle is absolutely important, not just in controlling diabetes but also in preventing the onset of diabetes. So, if someone is quite sensible in their diet, having a healthy diet with low carbs and high protein and moderate fat and less calories, and also is having a sort of a regular exercise program in whichever way it suits them, then healthy diet and regular exercise and keeping the weight under control really helps. It helps in controlling diabetes well in those patients who already have diabetes, and it also could help preventing diabetes who are at risk of developing diabetes.
That was very insightful, doctor. Doctor, I would like to ask you, is insulin needed for all diabetes patients?
No, the answer is clearly no. Insulin is not needed for all diabetic patients. Predominantly, there are two types of diabetes patients in the world. 90% of the diabetes patients have what we call as type 2 diabetes, who do not need insulin at least at the beginning. Their blood sugars can be controlled by lifestyle modifications and tablets alone, at least for the initial few years. It's only when the tablets stop working, so that the body, because the body cannot produce any more insulin, that is the time when they will end up needing insulin. The other type of insulin is called type 1 diabetes, wherein the body does not produce any insulin at all. Now, these are the patients in whom insulin must be started right from day one of the diagnosis. So, type 1 diabetes patients need insulin right from day one. Type 2 diabetes patients do not need it initially, but they may end up needing over a period of few years. Now, the other important sector is pregnancy diabetes. In pregnancy diabetes, more often patients end up needing insulin because there aren't many medications apart from maybe metformin and one or two other drugs which are deemed to be safe for use in pregnancy. So, type 1 diabetes definitely yes, and high chance of using it in pregnancy diabetes.
Thank you, doctor. Doctor, is insulin therapy harmful?
No, this is a question I get asked every day in the clinic. No, insulin therapy is not harmful if used in the right way and in the appropriate dosage. Now, it's important to understand what insulin is. Insulin is basically a hormone that is produced in the body every day. All of our bodies make insulin. As I explained to you earlier, this is needed for the body to use glucose, which is the energy molecule of the body. Now, the insulins that we have now are almost similar to the natural human insulin. We call it as human analog insulins. Previously, maybe a couple of decades ago, we used to have different insulins called insulins from beef called beef insulin, or insulin from pork called pork insulins. But now we are fortunate enough that we have human analog synthetic insulins, which almost nearly resembles human insulin. So it's not harmful if it is used for the right indication and in the appropriate dosage.
Thank you, doctor. Doctor, we also have some live questions coming up from people. Priyanka Gupta asks, can I get diabetes in my 20s?
It is possible to get diabetes in 20s, particularly if you are vulnerable or if you are at risk of developing something called as a monogenic diabetes. That's a different group of diabetes where patients typically can develop diabetes before the age of 25 years. And this usually is a genetic condition which is due to the presence of some abnormal genes in the body. Yes, you can develop. The other type of diabetes that one could develop at this age is type 1 diabetes, as you said, which requires insulin right from day one.
Thank you, doctor. Rajiv Ranjan Tiwari is asking, is diabetes connected to sugar?
Well, okay. So what is diabetes? Diabetes is a condition where there is abnormally high levels of sugar in the blood. So diabetes is basically sugar. So that's the common man's way of calling diabetes. So high levels of sugar in the blood is called diabetes.
Okay, doctor. One last question. Are there any new medications that I could use to help manage diabetes? Nohal Alex asks you.
Diabetes?
Is there any new medication that I could use to help manage diabetes?
Yes, there are quite a few actually, which came out in the last few years. Now, these are the molecules which actually have very robust evidence to say that they have multifactorial advantage in that they don't just reduce the blood sugars or control the blood sugars, but they also protect the heart, protect your kidneys, and guess what? They also will help people lose weight. So it is like buy one get three free, and this is an absolutely innovative molecule that has come up a few years ago. Yes, and there are a couple of molecules which are in the research stage at the moment, which hopefully should be available in the market in the next few years.
Thank you, doctor. This is all we have now. Thank you for having a lovely session on diabetes.
Thank you very much, Mayur. I hope you all find this helpful and useful. Thank you.